No one wants to live with pain, but when you are a college or professional athlete, healing from an injury is your job. We met up with a local doctor who makes it his job to get athletes back to the sport they love, playing at 100%.
And the good news is you don't have to be an elite athlete to get great care at Advanced Orthopedics of New England. So if you are living with an injury as well, this story could be one you need to hear.
These are the x-rays of your knee.
Dr. Brett Wasserlauf of Advanced Orthopedics of New England is meeting with University of Hartford basketball player Liz Garcia before she undergoes surgery to heal her knee after tearing her ACL. A moment she will never forget with 10 seconds left in a game she was winning.
I went down the court to take the layup and I saw her coming, but I thought I was just way ahead of her. So when I went up for the layup, she kind of hit me a little bit, and when I came down, I just came down wrong, and I knew I tore it because that pain was terrible. Yeah.
You could say Dr. Wasserlauf is a doctor to the stars. Star athletes, that is. He proudly displays the jerseys of athletes he's helped to get back in the game. One of the most notable, Major League Baseball player Albert Pujols. He's hoping to get Liz back on the court as soon as possible.
And when we shifted a little bit, there's just a little bit of play there. We call that a pivot shift. And again, for someone like me or for many people, they wouldn't notice that. But for an elite level athlete, that little bit of instability can affect their level of play, and that's what we're looking to help here.
Dr. Wasserlauf says his patient's goals may be different, but his goal is always the same: get you back in the game of life at whatever level you play.
What are their goals? Do they want to get back to being able to walk the reservoir for exercise? For athletes, obviously, it's a different goal. They have to get back to their elite level of sport. They need to be on the basketball court. They need to throw a pitch 90 to 100 miles per hour. So those are their goals. Okay, so how can we do that?
For Liz, Dr. Wasserlauf is going to add an extra ligament to help stabilize her knee.
Expect Liz to be back on that basketball court doing what she does best.
Okay, good. I like to drive to the basket, so a lot of driving, a lot of rebounding, a lot of action on the court. To me, I like to fly around the court.
Dr. Wasserlauf is an athlete himself. He runs marathons and also used to play basketball. Does that help in order to connect with the patients and really also understand what you're going after?
I think it does. A lot of these athletes I take care of, I've never achieved the levels that they achieve, but I could understand the demands on it and kind of put myself in their shoes a little bit more.
Liz says she feels good knowing Advanced Orthopedics of New England has helped so many of her teammates.
I'm not nervous going into the surgery because I know that I'm in good hands, and the school and Dr. Wasserlauf are taking good care of me. So,
if you're not an athlete, they can take care of you too. Here's his advice to moms of kids in sports.
Moms always know. They know. But especially with our younger athletes, certainly our kids, there are growth plate concerns and things like that. I think if there are any pain and swelling, should be checked out.
How do you know when you have to act fast?
I think when there's an injury with a severe amount of pain, a lot of swelling, or you felt a pop or something that just didn't seem right, that's more urgent. There you don't want to wait.
And it doesn't always mean surgery.
I think a lot of people have the fear of going to see the doctor, especially the surgeon, because they think the only answer is going to be surgery. And most patients I see, if we carefully think about their problem, carefully rehab them, thoughtfully approach how to get them back to the things they want to do, we could do it without surgery. And then even when we need to do surgery, the techniques are so much less invasive than they used to be.
Liz is more than ready for her operation.
I'm excited. I want to get the surgery done. I want to get it done now. I want to start recovering. I'm excited for physical therapy, and then I just can't wait till I can start getting back on the court and start doing drills again.
Good for her.
Yeah.
Yeah, and nice that we have a place like this right here. So for more information on Advanced Orthopedics of New England, you can visit them right on the website. It is ctortho.com. And they also have an urgent care that's open Monday through Saturday.
That is really terrific. All right, good.